I'm going to be demonstrating the lumbar disc decompression technique. And so this is a technique that we taught over at TCOM where I used to teach. We taught it 1 year. I thought it worked fantastic, and then they stopped teaching it. But I've since used it on the regular, and I've kind of modified it into a 2-person technique, which I feel like is a little bit more effective. And so what we're trying to do is saying that he has a lumbar radiculopathy in this case. And so let's say that he has an L4-5 radiculopathy that we're kind of dealing with right over here. So we want to create space in between that 4th and 5th vertebra, taking pressure off the disc, potentially allowing the nerve to kind of relax or just take the pressure off of it, potentially allowing the disc to be able to kind of maybe sublux back in, at the very least take the tension off of that area so that it's not so uncomfortable for them. And so when we're doing this, I'm going to have one person pushing up, another person's going to be pulling down, and then adjusting the myofascia. So what I'm going to be doing first is I'm going to be finding L4. In this case here, I'm going to find where the transverse process region should be. I'm going to be just a little bit medial to that. I'm going to kind of pressure palpate down to that fascial level where I feel like I'm kind of right over the osseous structure. And then I'm going to have a cephalad force that I feel just kind of moving up. Okay, so you feel what that feels like, Austin?
Yes.
Okay. And so I get feedback from them because I'm going to have somebody else doing that. I want to make sure it's reproducible. So I'm going to have you come over here and get that pressure on him over in that area. Okay. Simultaneously, I'm going to have him go ahead and bring his leg off of the table over here. So I'm going to have him scooch over a little bit. Okay. It shouldn't feel like he's getting pulled off the table. He needs to hang on to the other side of the table. I'm taking his leg and I'm putting it on top of my shoulder right over here. So I have his foot just kind of resting on top of my shoulder, and I'm going to be grabbing him just above the top of the calf and just below the knee, just below the popliteal fossa. Okay, and so that allows me to have some good traction. Now I always ask them, make sure this isn't hurting on the foot, the ankle, the knee, or the hip. So you give me feedback if that's bothering you. So let me have you put that pressure cephalad on him. Okay, does that feel like what I was doing before?
Yes.
Okay, and then I'm going to be pulling down here. Okay, and it should feel like it's opening up that space right where we're at. Does it feel like it's opening it up?
Yes.
Okay, after I feel like it's opening it up, then I myofascially see internal or external rotation. So it likes to go more into external rotation here. Sometimes I adjust the amount of flexion that I have on it or extension, and then I have them take a deep breath in and out. Hold that breath out as long as you comfortably can. And then I just do an extra little pull. And that's usually enough to be able to get that area to soften up quite a bit. So notably, if I'm trying to kind of work on that area with some muscle energy, HVLA, anything like that, and it's just so tight, so resistant, and notably if they're having active radiculopathy, I find that sometimes after doing some soft tissue, doing this technique then allows the rest of the OMT to go a lot smoother and have them walking out without that radicular pain kind of coming down the leg.